our policy is that we do not fact-check politicians' speech, and the reason for that is that we believe that in a democracy, it is important that people can see for themselves what politicians are saying.
We hear all these studies and all this polling that moms are afraid to go back to work because of letting their children go to school. They shouldn't go to school because they're going to be exposed. And if the moms go back to school, then the elderly grandparents are
right. Well, this is the big. Sure. Yeah, this is a big issue because people are afraid, not that their children are going to get particularly ill, because I think they're learning the truth that this infection is being tolerated well by children, but certainly they look at their environment, their particular unique family, and I think in some situations that may be an appropriate fear. However, I do think that as a general comment, a general rule through the country, kids can go back to school. Maybe a few kids here and there, their living situation, who they're being cared for, that can be a potential problem. But again, for younger children in particular, they're not the ones passing on the disease to the adults.
I'll talk about it. I mean, maybe Dr. Emanuel can speak to that, or somebody else.
Well, hydroxychloroquine, yeah. I mean,
in terms of as a prophylaxis.
that can be done. Yes, that can be used.
Yeah. Really quickly,
Okay. We're talking about we can't go to open our businesses, we can't go to school, and parents are scared to get treated. And I personally have put over 100 people on hydroxychloroquine prophylaxis, doctors, teachers, people, healthcare workers, my staff, me. I see over 15 to 20, sometimes 20, 15, 10 patients a day. I use a surgical mask. I've not been infected. Nobody I know has been infected that's around me. So this is the answer to this question. You want to open schools? Everybody get on hydroxychloroquine. That is the prevention for COVID. One tablet every other week is good enough. And that is what we need to get across to the American people. There is prevention and there is cure. We don't have to lock down schools. We don't have to lock down our businesses. There's prevention and there is cure. So instead of talking about masks, instead of talking about lockdowns, instead of talking about all these things, put our teachers on hydroxychloroquine. Put those that are high risk on hydroxychloroquine. Those that want it. If you want to catch COVID, that's cool. But you should be given the right to take it and be prevented. So that's the message. All this stuff that we're putting together is not necessary because hydroxychloroquine has a prevention. Hydroxychloroquine is a prevention for COVID.
Earlier I heard you say that
hydroxychloroquine.
Yeah, that drug was the
cure.
But you also said measured with zinc and other things.
Yes.
You guys also said that previous doctors have used it, but they've used it in the wrong dosage. So I keep hearing the drug, but then what is the right dosage? What is the right mixture?
Yeah, that you're going to discuss with your doctor. But let me let Dr. also take that.
Yeah, that's a great question because the fear of this drug has driven the whole political situation has driven the fear towards this drug. So let's address that. This drug is super safe. It's safer than aspirin, Motrin, Tylenol. It's super safe, all right? So what the problem is in a lot of those studies, they did very, very high doses, massive doses. All through the country, they did the REMAP study, the Solidarity trial. That was the World Health Organization trial, and also the recovery trial. They used 2,400 milligrams in the first day. All you need is 200 twice a week for prophylaxis. They used massive toxic doses, and guess what they found out? When you use massive toxic doses, you get toxic results. The drug doesn't work when you give toxic doses, okay? It's a very safe drug. It concentrates in the lungs, 200 to 700 times higher in the lungs. It's an amazing drug because in the bloodstream, you're not going to get high levels, but you get massive levels in the lungs. So you're going to find yourself, if you're prophylaxed, as soon as the virus gets there, it's going to have a hard time getting through because the hydroxychloroquine blocks it from getting in. And then once it gets in, it won't let the virus, it won't let it actually replicate. It'll actually bring in zinc, and zinc will mess up the copy machine called the RDRP. So with the combination of drugs, it's incredibly effective in the early disease. By itself, it's incredibly effective as a prophylaxis. So I hope does that answer the question?
Yeah, I want to emphasize on something that Dr. Urza just said because I love the question. This is a treatment regimen that's very simple and it should be in the hands of the American people. The difficult aspect of this is that at the moment, because of politics, it's being blocked from doctors prescribing it and it's being blocked from pharmacists releasing it. They've been empowered to overrule the doctor's opinion. Why is this not over the counter as you can get it in much of the world, in almost all of Latin America, in Iran, in Indonesia, in sub-Saharan Africa? You can just go and buy it yourself. And the dose, my friends, is 200 milligrams twice in a week and zinc daily. That's the dose. I'm in favor of it being over the counter. Give it to the people. Give it to the people.
Two more who can answer this question, and they know this information.
Hi, everyone. I'm Dr. James Tadaro. I just want to add a couple comments to what Dr. Gold was saying. If it seems like there is an orchestrated attack that's going on against hydroxychloroquine, it's because there is. When have you ever heard of a medication generating this degree of controversy? A 65-year-old medication that has been in the World Health Organization's safe essential list of medications for years. Okay, it's over the counter in many countries. And what we're seeing is a lot of misinformation. So I co-authored the first document on hydroxychloroquine as a potential treatment for coronavirus. This was back in March, and that kind of kicked off a whole series of a storm on it. And since then, there's been a tremendous amount of censorship on doctors like us and what we're saying, and a number of us have already been censored. That Google document that I co-authored was actually pulled down by Google. And this is after now many studies have shown that it is effective and it is safe. You still can't read that article. And there's also this misinformation out there. And unfortunately, this has reached the highest orders of medicine. In May, there was an article published in The Lancet. So this is one of the world's most prestigious medical journals in the world. Okay? The World Health Organization stopped all their clinical trials on hydroxychloroquine because of this study. And it was independent researchers like us who care about patients, who care about the truth, that dug into the study and determined that it was actually fabricated data. The data was not real. And it was we did this so convincingly that this study was retracted by The Lancet less than 2 weeks after it was published. This is almost unheard of, especially for a study of this magnitude. So it's, I apologize to everyone for the fact that there is so much misinformation out there. It's so hard to find the truth. And unfortunately, it's going to take looking in other places for the truth. It's going to be, that's why we formed frontline doctors here, to try to help get the real information out there.
What did you say your name?
I'm Dr. James Tadaro.
Your website.
Yeah, so most of my thoughts I actually publish on Twitter. Twitter has been great lately. So my name is James Tadaro, MD, Todaro, MD. But I also have a website, medicineuncensored.com, which contains kind of a lot of the information about hydroxychloroquine. I think is much more objective than what's going on in other media channels.
That's important because, as I understand, from not only from doctors but from other people in the media, that YouTube has blocked information specifically about hydroxychloroquine.
So I'll go ahead and address that real quickly. I would say Facebook and YouTube have taken the most draconian measures to silence and censorship people, and this is coming from the CEO of YouTube as well as Mark Zuckerberg, saying anything that goes against what the World Health Organization has said is subject to censorship. And we all know the World Health Organization has made a number of mistakes during this pandemic. They have not been perfect by any means. Twitter, although they have some flaws and faults and flag certain content and stuff, they really still remain one of the freest platforms to share dialogue, intelligent discussion regarding this information. And many of us here today actually connected on social platform mediums like that.
Would you talk about what you mentioned earlier about the medication and how long it's been around? And
Sure thing. I'm Dr. Joe Latipo. I'm a physician at UCLA, and I'm a clinical researcher also. And I'm speaking for myself and not on behalf of UCLA. So I want to say that, so I'm thinking of the people who are behind the screens that are watching what you guys are broadcasting. And I want to share with you, because there's so much controversy and the atmosphere is so full of conflict right now, that what this group of doctors is trying to do fundamentally is really to bring more light to this conversation about how we manage COVID-19 and the huge challenge. And that's what this is ultimately about. And bringing light to something means thinking more about trade-offs, about, one of my colleagues said, unintended consequences. And I actually think that's not even the right, that's not the right word. The right word is unanticipated consequences. Really thinking about the implications of the decisions we're making in this really, really extraordinary time that we're in. So, so I'm sure people are listening to some of the discussion about hydroxychloroquine and wondering, what are these doctors talking about? And these are doctors that take care of patients, board certified, med school, great med schools, all of that. How could they possibly be saying this? I watch CNN and NBC and they don't say anything about this. And that's the point. There are issues that are moral issues that really there should be a singular voice, So for me, issues related to whether people are treated differently based on their sex or race or their sexual orientation, I personally think those are moral issues, and there's only one position on those. But COVID-19 is not a moral issue. COVID-19 is a challenging, complex issue that we benefit from having multiple perspectives on. So it's not good for the American people when everyone is hearing one perspective on the main stations. There's no way that's going to serve us. So, so the perspective most people have been hearing is that hydroxychloroquine doesn't work, right? That's the perspective that most people have been hearing on the mainstream television. And I believe that perspective too, until I started talking to doctors who had looked more closely, some of the physicians behind me here, who had looked more closely at the data and at the studies. So it is a fact that several randomized trials have come out so far. That's our highest level of evidence, and have shown that hydroxychloroquine, their findings have generally been that there's no significant effect on health. There's no significant health benefit. So that's a fact that the randomized controlled trials have come out so far that have come out. In fact, there were 2 or 3 big ones that came out over the last 2 weeks in Annals of Internal Medicine, New England Journal of Medicine, and I think one other journal. It is also a fact that there have been several observational studies. So these are just not randomized controlled trials, but patients who are getting treated with this medication that have found that hydroxychloroquine improves outcomes. So both of those things are true. So there's evidence against it and there's evidence for it. It is also a fact that we are in an extraordinarily challenging time. So given those considerations, how can the right answer be to limit physicians' use of the medication? That can't possibly be the right answer. And when you consider that this medication, before COVID-19, had been used for decades, right, by patients with rheumatoid arthritis, by patients with lupus, by patients with other conditions, by patients who needed, who were traveling to West Africa and needed malaria prophylaxis. We've been using it for a long time, but all of a sudden it's elevated to this area of looking like some poisonous drug. That just doesn't make sense. And then when you add on to that the fact that we've had 2 of the biggest journals in the world, New England Journal of Medicine and Lancet, as my colleagues say, retract studies that found, interestingly, that hydroxychloroquine harmed patients, right? Both of these studies. And they had to retract these studies, which really is unheard of. That should raise everyone's concern about what is going on. So at the very least, we can live in a world where there are differences of opinion about the effectiveness of hydroxychloroquine, but still allow more data to come, still allow physicians who feel like they have expertise with it, use that medication, and still, talk and learn and get better at helping people with COVID-19. So why we're not there is not good, doesn't make sense, and we need to get out of there.
Listen, let me just put a little bit of that. I have seen 350 patients and counting. Put them on hydroxychloroquine, they all got better. This is what I would say to all those studies. They had high doses, they were giving the wrong patients. I would call them fake science. Any study that says hydroxychloroquine doesn't work is fake science. And I want them to show me how it doesn't work. How is it going to work for 350 patients for me and they're all alive, and then somebody say it doesn't work? Guys, all them studies, fake science.
What was your question? Thank you. Last question.
I heard there mention of increased anxiety, suicidal ideation, substance abuse, various mental health issues as a result of school closures and shutdowns. Is it your recommendation that more federal funding for programs that help to deal with those issues?
I don't understand how you would go to that conclusion if the problem was that the schools are shut down and it's causing it, and we need to open up the schools. Yeah, I would go to the school. I would open up the schools because the most important thing for children is to socialize and to be with other kids and to learn. Yeah. Let's get kids back in school. You don't believe that? Kids back in school. We're in favor of kids back in school.
Thank you, everyone.
Back to work.
Thank you very much. And we are going to be going back live, continuing our summit, so you can continue watching once we get back. We may be running a couple minutes late, but we'll be back right around 3 o'clock. Thank you so much, everyone, and thank you for coming for the press conference.
It's fake science, girl.
Get them, girl.
It's fake science.
That's right. I believe you. I believe you.
Low zinc levels. He's more specialized. He's more specialized, so I have to defer. But depression is caused by low zinc levels. And when you go into a hospital nowadays, they don't test for low zinc levels. Low zinc levels are manifested by loss of sense of smell, loss of taste. Why are these also symptoms of COVID? Right? COVID, loss of sense of smell, loss of taste, right? And the reason is because zinc is the natural thing that used to fight the COVID. What happens is the zinc stops RNA polymerase, all right? And the hydroxychloroquine allows the zinc to go into the cells.
I'm wondering
to stop the RNA polymerase.
Because there was
hang on.
It was
hang on, I
implied
got to give you the science behind it. So if you allow the zinc, I understand. And let me explain it a little bit better. The zinc stops RNA polymerase, and it's used up by your cells in the normal fighting of COVID. So if you never took hydroxychloroquine, you'd still be zinc depleted. We're in a natural state of zinc depletion in the United States, but the COVID decreases your zinc even more, and you need it to fight off any virus. That's why your mom always said, take your zinc, right?
So is the problem with children on psych units that they have low zinc levels?
No, we're talking about the COVID and how that makes the...
So my question was about if federal funds should be diverted to helping therapists, social workers, and other frontline workers to deal with the psychological issues that were mentioned by your colleague, that shutdowns in the government and school closures cause an increase in suicidal ideation and substance abuse and anxiety. So those environmental factors are what cause those mental health issues. So doesn't it stand to reason that then funds to help those institutions deal with the problem should be receiving more funding?
I'm going to defer to my psychiatrist.
You didn't hear me ask the question.
Here, and
you don't want to
no, because I mean, first we need to take care of the biological basis, which is the zinc, which is the vitamin D, lack of vitamin D. We're dumping our milk. We're dumping our milk. We're dumping our milk in the gutters, in the manure pits right now. And if we would get that to the kids,
that's hard to believe.
If we would get that to the kids out of school, that would be very helpful.
Okay.
So I'll defer to my colleague.
So my question, I still haven't gotten a clear answer on it.
Yeah, I'll try to answer. It's not, public policy is not my expertise, but I can try to.
Oh no, it's not really about. It's not my expertise either, actually. But I was wondering, since your colleague said that as a result of school closures and government shutdowns would cause an increase in suicidal ideation, anxiety, substance abuse, and a variety of other issues, I'm wondering if federal funding should be diverted to frontline workers, social workers, mental health therapists.
So the answer to your question is this. I see it this way. Harm has already come, is what we're saying. So the question is, harm has already come. What should we do about that harm? And I don't know the inner workings of the government, but the actual, to say that harm has already come and to say that we're going to do something about it makes sense. So to me, as a doctor, I think if we know harm has come, if you and I know we already got run over by a car, I think it makes sense to let me go ahead and go to the hospital and get my thing.
People in my profession to be able to help those kids.
I think it makes a lot of sense. So I'm going to just say, to me, it makes sense. And I think it's fair.
I appreciate the well-rounded concern. It just kind of stops with concern and it doesn't continue into action. And the congressman, and I'm not sure who he was, maybe you could actually give him patience in the
Hey guys, this is Matt Purdy of Breitbart News. We want to continue bringing you the panel of doctors who are speaking. Thank you so much for tuning in. Stay tuned. We're going to be coming back live in just a little bit. And sorry for a little overexposure here. Obviously, just ripped my mic off the stand. But we're going to bring the action back to you. We're going to go live with a panel shortly, so stay tuned to Breitbart on Facebook. Follow us on Facebook, Instagram, Twitter, of course on our website, Breitbart.com, and of course YouTube. Stay tuned. We will be back shortly. Have a good one, guys.